Hi, everybody, and welcome to a sidebar conversation with me, Professor Delpreet. So these sidebar conversations are new. Just something I kind of thought of would be helpful for to maintain a little bit of a connection, so you can see my face kind of throughout the course, and realize once again I am a real person. So hopefully you find them helpful. Really, it just kind of stemmed out of my idea that I had that sometimes I just have more to say on something. That's not necessarily content related or testable material, but I didn't want it to get lost in the lecture. So this is just my extra thoughts that you are welcome to listen to. This is not anything you're going to be graded on or tested on or anything like that. So let me know if you find them helpful. Maybe you'll find them a little funny. Maybe. But just let me know. So this week, the topic is chronic neurological conditions. So neuro is a love of mine. I started my nursing career on a neurotrauma floor. So my love for the brain started there. I also have a couple family members with chronic neurological conditions, including MS. And I also lost my grandfather a little over a year ago to Alzheimer's dementia. So that in particular is very near and dear to my heart. And especially so I work in long-term care. So a lot of my patients have chronic neurological conditions, whether it be sequelae from a stroke, or they have Parkinson's, or MS, or dementia. I've taken care of patients with ALS when I was a nurse on the floor. So I do have a lot of experience in treating patients with these conditions. With that said, I wanted to talk about how do we care for these patients, not meaning what meds do we prescribe, what treatments do we prescribe. How do we care for these patients with respect and dignity? So that's kind of the basis for that. So do we want to focus on dignity? Remember, these are people. They may not know who they are, or where they are, or what year it is. But they are people and they deserve our respect, and we deserve to care for them with dignity. First things first, we want to make sure we use preferred names. As you would introduce yourself to anybody else, hi, I'm Jackie, I'm going to be your nurse practitioner today. Is it okay if I address you as Mr. Smith, or do you prefer Joe? And ask them, and they'll tell you. But sometimes we get lost in the basic niceties and basic, introductory things because well, they don't know what's going on anyways. Why does it matter? It always matters. Also, kind of along those lines, we want to avoid patronizing them. So we're not going to call them sweetie, honey, dear. Even though they might be sweet little old ladies, we don't refer to them as that. And this one I have a hard time with sometimes because as a mom, everything is honey, sweetie, dear. So sometimes it just comes out. And we don't mean it negatively. It's somebody that we care for and, they're being nice to us and, it just slips out. But just apologize and try not to do it again. We want to be at eye level with them, especially somebody with a cognitive deficit or, we don't want to talk down to them. So if they are laying in a bed, say in a long-term care facility, pull up a chair next to them and sit eye level with them. If they're on your exam table, do your assessment and such, but in regards to the conversation, make sure you're at eye level with them. Help them sit up first before you continue with your conversation. We want to speak to them, not at them or about them. So am I likely to get a very good history from somebody with dementia? Probably not, depending on how advanced it is. So I'll say in my note, most of the history provided by the nursing chart and the nursing staff, but, my patient can still contribute. If they're verbal and they have the ability to still speak, they can still tell me what's wrong, in a sense. They can still feel pain. They can still be angry or depressed or happy or, feeling well. So even though they may not be able to give a very good very good quantifiers or a very good story around how they're feeling and why they're feeling it, it's still important to ask them. And even, we want to make sure that if somebody else is in the room with us, whether it's a staff member or a family member that comes into the appointment with them, that we're not just speaking to that family member or the staff member, The patient is still a very important person in the room, the most important person in the room. So we need to make sure they are included in the conversation. We're not speaking about them around them. Okay? Try not to overly correct them. So, especially patients with dementia, what's the point? So, in the early stages of dementia, it's okay to correct them a little bit. Like, if they get the month wrong or the year wrong, just nonchalantly say, oh, well, actually, it's, 2021, and move on to your next question. Don't dwell on what they got wrong, because in the beginning stages, they know they're getting forgetful. And then the more times that it's pointed out to them that they're incorrect, imagine how frustrating that is to be constantly reminded that you can't remember. That's awful. In the later stages of dementia, you're not going to solve anything. If I've got a patient with advanced dementia and she thinks it's 1975, okay. I might say like, oh, actually it's 2021, but how are you feeling today? And just, like I said, just moving on. We're not going to dwell on it because at that point, we're not going to correct anything. If she thinks it's 1975, hopefully 1975 was a really good year and she's going to have a good day. And then patience. So important. So, like, in patients with dementia, they're not always going to be very quick with their stories. Chances are they're going to drift off and go on a tangent, or they're just going to be completely off base. They tend to be older, so they're not going to move as quickly. So patience is so important. You can't rush them through anything. In patients with Parkinson's disease, what are the symptoms? Bradykinesia, rigidity, tremors. So whether or not you're waiting for them to walk into the room, to get up onto the exam table, to hand you a piece of paper with something on it, it's going to take them a little extra time. Be patient. Don't just, rush and help them in or, rush and grab things away from them. Be respectful. In patients with MS, sometimes there is cognitive deficits, but, for the most part, they're totally aware, but their body is not functioning how they want it to function. They've got numbness or paresthesias, or they have incontinence now that they didn't have before. So, patience and recognizing that sometimes these patients are trapped in their own bodies, especially with ALS. The mind is completely aware with ALS, but the body, the muscles fail and they eventually become paralyzed and, they die from respiratory arrest. So imagine being in their shoes, being completely aware of everything that's going around you and not being able to move how you want and, communicate how you want maybe. And just be patient and think about that. So those are just my sidebar thoughts on caring for patients with chronic neurological conditions, most particularly dementia is what I talked about mostly. Hopefully you found it helpful. Hopefully you found it thoughtful, thought-provoking maybe, and hope you enjoyed it. And always give me some feedback if you didn't.